here at UT Southwestern, and thank you for joining our chat on skin cancer prevention and treatments. Today we're joined by physician assistant Cynthia Griffith, who works in the dermatology clinic here at UT Southwestern Medical Center. Don't forget, just a couple reminders that I always say, don't forget to like and share our conversation so that other people can see it, and also be sure to write your comments in the comments section below this live broadcast. So if you have any problems at all, if the sound goes in and out, please try refreshing your browser. That's usually the best option. And now we're going to go ahead and get started with Ms. Griffith. So thank you for joining us.
Thank you for having me.
Absolutely. So tell us, how common is skin cancer? Do you see it a lot?
Yeah. So skin cancer is really common. 1 in 5 people in the United States will develop skin cancer. The most common types of skin cancer are basal cell and squamous cell carcinoma, but then there's also melanoma.
Okay, and so what does it look like?
Yeah, so I tell people that cancer doesn't have to look like any picture. Anything on your skin that is growing or changing could be skin cancer. But generally, we look at, my patients will tell me that it might look like a pimple that didn't heal for them, a sore that doesn't heal, or with melanoma, we think more about pigmented spots. So spots that look black or blue, but they can also look pink. They don't have to have any pigment.
Oh, okay.
So that's why we tell people any spot that's new or changing, whether it has pigment or not, we want to really evaluate that spot. But typically a pimple, a sore that doesn't heal, any new spot that draws your eye, let's get it checked out.
Okay, so is it more common for certain ages, or is it more common for males or females?
Yeah, so unfortunately we're seeing this, melanoma is the most common growing cancer in people that are under the age of 30. So that's a really unfortunate statistic. Tanning beds have been associated with that bump up in patients that have melanoma at that young age. So we definitely, you're not exempt from having skin cancer because you're one age or another. Anybody that has skin can develop skin cancer. So if you're in your 20s or even in your teens and you have a mole that's growing or changing, especially if you have a tanning bed history or family history, you really want to get those spots checked out. But then also we can sort of start developing them as time goes by as well. As sun has time to interact with your skin and change that DNA and not get adequately repaired. So as we age, it can also be something that we're concerned about.
Okay. I know I read somewhere, and somebody had asked this earlier, they said that they'd heard that older adults are also at high risk?
Yeah, so it is kind of a curve where we are seeing more cases sort of in the 20 to 30 range, and then more cases around people that are in their 60s, 70s. So yes, it definitely does occur at those time points, but really anybody, whether you're in your 30s, 40s, 50s, I see all those patients regularly in my clinic that can develop a new spot.
That makes sense. So what are some of the best ways to protect your skin from ever developing this in the first place?
Yeah, so prevention is really the key because we don't just want to talk about what to do when you get skin cancer. We really want to prevent everybody from getting to the point where they ever have to have a biopsy or undergo a surgery. There's several things that you can do. So sunscreen is what we hear about. Some important things with sunscreen to look at are really making sure that you have a broad spectrum sunscreen. In the past, so SPF is really a marker of the amount of UVB, which is the rays from the sun that cause burn. So the redness, blisters, but skin cancer can also be caused by UVA, which is the sun ray that can cause more actually tanning and an aged appearance. So wrinkles, loss of collagen, color that is sort of darker in one area and lighter in another area. So we really want to make sure that you have coverage that's broad spectrum, UVA and UVB, and it'll say on your container broad spectrum. And then you really want to have an SPF of 30
Okay.
To 50, and then make sure that you're reapplying that sunscreen.
Okay. And you want to reapply it every 2 hours?
You got it. I tell my patients to go ahead and set an alarm on their phone so that it'll go off and they can go ahead and take that as a time where they can get out, pat dry, and then put that sunscreen on. Go ahead and take a water break while they're doing that, and then get back in and reset that timer, because you'll be surprised how fast that time will go by when you're out having fun or at a ball game.
Yeah, no. That's happened to me. Unfortunately, I've missed it a few times.
Yes, but that timer can be a good way to kind of reset. But then also not just sunscreen, but wearing like wide-brimmed hats.
I have an example. Let me see where to go.
Awesome.
Here's an example of a wide-brimmed hat. Does this work?
That would be great. Okay. I love it because it covers the ears. And it's going to cover the tip of her nose. Okay. Ball caps don't really provide coverage for the tip of your nose or your ears. Okay. And I tell people that's precious real estate. Yeah. Because you don't want to have a procedure on your ear or on the tip of your nose. There's not a lot of extra skin there.
Yeah, no, there's not.
Wear that wide brim hat. I like it.
Okay.
I like it.
All right, perfect. Good example. Okay. All right, now with the sunscreen. Now you mentioned 30 to 50. One of the questions was they were asking about waterproof sunscreen. It was from Andy. She says, is waterproof sunscreen more effective than a high SPF?
So
is it even really waterproof?
Yeah. So there is no longer the ability for any product sold in the United States to have the labeling waterproof or sweat proof. That's just not a thing. So what actually the labeling now has to say is water resistant to either 40 or 80 minutes. Okay. So we want you to try to get the one that's water resistant to 80 minutes because that's the most protection. But if just like makeup or mascara or anything that you put on, if you get in the pool, if you get out and you're drying off and you're wiping off the water, you've already wiped off your sunscreen with that, regardless of if it's been 40 or 80 minutes. So anytime you're out of the water patting dry, wiping that water off, you've already wiped off your sunscreens. Go ahead and reapply after that.
Okay. Now what about and this is somewhat related to Andy's question, what about sunscreens over 50? Are they worth it? I mean, I saw 100 on the counter the other day.
Right. So the issue with that sometimes is they can be so thick and pasty that no one likes to use them. Okay. So if you're not going to use it because it's so thick, then that's the issue. But if you if you have an SPF 100 that you like, go ahead and use it. The issue too is they can sometimes be more expensive. Okay. And really the issue is we want to reapply every 2 hours regardless of what your SPF says. So because you have wiped it off or sweated off in 2 hours. Right. So if you like SPF 100, you have it and you'll use it, that's great. But most people, they don't like how it feels. Gotcha. And the whole family won't necessarily put it on. Okay. Yeah.
So that actually got to Crystal's question. She's wondering, is it true that SPF 80 is no more effective than SPF 50? And is there a threshold for protection?
Yeah. So I don't want to get too in the weeds, but SPF is a logarithmic scale. So basically, SPF 30, you're blocking about 96-97% of the rays that we were talking about, UVB specifically. When you get higher than 30, you're basically working with that couple of percent in the logarithmic scale. So you're only getting an additional 0.5% or percent of coverage. Okay. So really, find the one that you like.
That you'll use?
Yeah. If you happen to like the formulation of one that's 85, that's great. Okay. But I wouldn't pay more for it because you're really only getting a couple of percentage of extra protection, really, that using it correctly. So reapplication and applying an adequate amount is key.
Okay, that makes sense. So while we have a second, I want to say thank you to everybody that's tuned in and is watching. Please continue to ask the questions in the comments field. They're doing great. We've got another one that came in beforehand. They were wondering, they'd read that I think they don't like sunscreen, but that sunscreen, that the ingredients they're worried they may cause cancer. Is that founded? Is that unfounded?
Yeah, so there's a lot of information, I feel like, out in the popular media about issues like this. For my patients that are concerned with things like this, I refer them to using a sunscreen that has only physical blockers in them.
Oh, okay.
So products that contain zinc oxide or titanium dioxide only on the labels.
Okay.
So these are products typically that are marketed to people for sensitive skin or children. They're great in that they literally, how they work is they sit on top of the skin and they reflect the light back out. So that chemical sunscreens actually work more like natural melanin in our skin. They absorb that energy and try to deflect it so that it's not absorbed by DNA. But these physical blockers, literally, it's the same as putting zinc oxide or diaper paste on your baby's bottom. It's the same active ingredient. So if you're concerned with those things, you can use those. But really, the risk of skin cancer is a real thing, so we really want to be using sunscreen. Whether you use a physical blocker and feel better about using that, but please put sunscreen on yourself and your children to protect them from the real risk of skin cancer.
Okay, we had a whole flood of questions just came in. So Lori's wondering, is it true you should throw away your sunscreen once a year and buy fresh sunscreen?
So we really want to be buying sunscreen and using it up. Yeah, we want, because we do, over time, the active ingredients do degrade, especially if you're taking them to the beach in your beach bag with you. It's getting hot. So yes, the active ingredients do degrade, so we do, that would be good. A good once a year would be great, but also use it up.
Use it up. Perfect. Great question, Lori. So now we've got one from Maria. She says, I heard raspberry seed oil has great UV protection. Can this be a good alternative than the usual sunscreen? Great question, Mary.
Yeah.
Maria.
So that's a really interesting question. I'm not sure about raspberry seed oil for UV protection. Sometimes when we're putting fruit extracts on our skin, especially citrus extracts, you can actually get a sun reaction that can be blistering. So sometimes I generally tell people, especially no citrus, like lemon or orange, those things, if you accidentally squeeze, like the common thing is maybe making margaritas and squeezing some lemon, you can actually get a blistering reaction from it. So I would steer clear of fruit, especially the citrus, if you're, for instance, making your own or something like that, because you actually can get a rash from being in the sun with that.
Okay, that's good. Good to know. Good feedback. So Veronica, she's wondering, what should the SPF be for children?
Yeah.
That's a good question. I had that same one.
Yeah. So the same guidelines of between 30 and 50, but I like to use physical blockers on kiddos.
Okay.
Because some kiddos can be sensitive, especially if you're rubbing it over skin, that maybe if your kiddo has more of an atopic dermatitis or eczema, they have a little bit of broken areas on their skin. We don't really want to use any chemical blockers, but physical blockers like that zinc oxide and titanium dioxide. And just make sure then that there's no other ingredients in those, but they're all marketed for kiddos.
Okay, and that's the stuff that usually looks like the white
Exactly
streaks.
right. Exactly right. So that's what's the trade-off is. It is thicker, but you really, with those kiddos, you're just having the sunscreen sit on top of the skin so that it just reflects that light right back off.
Gotcha. Yeah. Great question. All right, let's see, Lonnie. We've got one from He Says, how long is being too long outside, and how do we recognize skin cancer or things to watch out for?
Yeah. So I love for people to be as active as they want to be outside. I say, Dr. Lay, one of our doctors, he always says, sun is good for the soul, but not for the skin.
Yeah.
So if you're going to be active outside, that's great. But I try to tell people, do it before the hours of 10 in the morning. So get up early and exercise before work, or try to do it after 4.
Okay.
So you can shield yourself from the most UV exposure, and also if you're exercising or being outside, you can have a higher risk of becoming dehydrated during that time too.
Okay, good question. That actually brings up something. We have a number of people, particularly here in Texas, that they work outside. So how should they protect their skin?
So in addition to sunscreen, an important component for people that are working outside, people that are running or biking long distances, people that are staying outside a lot, landscapers, we really want to wear protective clothing. And even if you don't like sunscreen or want to protect your kiddos without using a sunscreen, wearing long sleeve. We have those great UV shirts that are great. So buying one of those and wearing them, they're actually that kind of wicking material, so they're cool to wear. And so that's what I would recommend for people that are going to work or spend a lot of time running, cycling, landscaping, out, wearing those sun protective clothing to protect you.
That makes sense. So this one is already gone off the screen, but she was wondering, she said that that tanning is basically you're damaging your skin. Is that true?
Yeah. So there's kind of the myth out there that we need to go get a base tan at the beginning of the summer to sort of be protective against the sun for the rest of the summer, and that's actually not that's a myth. It's not true. So anytime your skin has tanned, that's because UVA has caused that tanning reaction. You've had enough UV exposure to tan your skin, and in addition to having that tan as an effect, you're also damaging the DNA. So it's really kind of a sign that you've had some sun damage. And the good thing is our DNA is able to rebuild and be protective to us. But if we keep doing that over time, that's when we get issues.
Okay. Yeah. So another question, this one came from Crystal that I seem to have lost it on here. That's Facebook for you. She was wondering, is spray sunscreen as good as lotion, or should you stick with lotion?
Yeah, so lotion or creams are superior to the spray. So lotion or creams superior to the spray. But if you are not going to use anything, the spray is better than nothing.
Okay.
I tell people, if you have a spouse or you yourself are just not going to reapply, you might get that first one on, then maybe putting a spray in the golf bag or putting a spray in the beach bag would be better than nothing. But if you're just purely wanting to know what's the best, a cream or lotion is going to be the best.
Okay, so what is it, the spray that you don't know where it's going, really?
Yeah, so most of the time people don't apply adequate amounts of sunscreen, and that is just amplified with the spray. Gotcha. So I really tell people, if you want to use the spray, spray it on where you can see it, and then rub it in. So don't just spray it like you're spraying perfume or spraying hairspray kind of all over. You really want to spray it on your arm in a systematic fashion where you can see it and then rub it in. And again, don't use the spray over damaged skin. So if you have eczema, atopic dermatitis, your kiddo has eczema, it really burns. So we don't want to do that.
Oh gosh, yeah, we don't want to burn our children.
Right, it can hurt. It just is painful. Yeah, it's painful to the kiddo.
Okay, so we've got about 5 minutes. I know one of the things you wanted to talk about was here at UT Southwestern, we have a skin cancer clinic for transplant patients and for others who are immunocompromised. Can you tell us a little bit about that? Maybe why are those patients more susceptible?
Yeah, so the immune system protects us against the development of skin cancer. UV damages our DNA, but the body is amazing in its ability to repair itself. But our immune system is a component of that. So in people that are immunosuppressed, they get skin cancer more frequently. And their skin cancer tends to be more aggressive. So if you're immunosuppressed, if your doctors put you on a medication for rheumatoid arthritis or Crohn's disease, or you have a heart or lung transplant, or you have a leukemia or lymphoma, if you've been told you're immunosuppressed, you need to be seen by a dermatologist that knows about immunosuppression and the risk to the skin at least once a year.
Okay, once a year. Let's see. Well, we had another question came in. Let's see from Maria. She says, can titanium dioxide nanoparticles be harmful to the body because they're small enough to be absorbed? And how do you know the difference?
Yeah, so with those physical blockers, so the zinc oxide and the titanium dioxide, they actually work by sitting on top of the skin. Okay. So
they're not absorbed?
So they're not wiggling their way down and getting into the skin. They're sitting on top of the skin. Think about, it's the same active ingredient as, say, diaper paste. So we really want to just have it sit on top of the skin. So we really want to be using these products because we know that there's a proven risk of skin cancer. So we really want to be using them.
Okay, that makes sense. Really good question.
Yeah.
So one more from Lori that we skipped earlier. She says, what about self-tanning lotions? Are they safe?
Yeah. So if we're talking about the lotions that you put on daily, and they sort of will tint your skin. Those I love. I love the tan towels or the lotions that you apply that gradually over time sort of tint the skin. Different from the tanning lotion that's more of an oil that you would put on before you go sit out in the sun. So that really confers no protection from the sun. So that would be as if you were going out without any sunscreen. So I would not recommend the tanning lotion that's more of a tanning oil.
Okay.
Yeah.
So we talked a lot about skin cancer prevention. Are there other ways you can get skin cancer besides being out in the sun?
Yes. Yeah, so there are genetic syndromes that can predispose people to develop multiple skin cancer. You can definitely have a family history of skin cancer. And then there are certain other exposures, like if you had radiation, like some people got radiation for their acne treatment back in time. And so if those are risk factors that apply to you, then that would be an additional way you could get skin cancer.
Okay, that's good to know. So we got to wrap it up. We've got a couple more questions that we'll take really quickly though. So Yvette is wondering what to use for kiddos that suffer from eczema for sunblock.
Yeah, so really those products that say for sensitive skin or for children, those all just have the physical blockers. They don't have any chemical blockers. Those would be perfect to use on the skin because literally they'll just sit right on top of the skin. They won't be an issue for kiddos that have eczema or atopic dermatitis. Now, if you have any broken skin, so anything that's bleeding, any sores, open areas, then you don't want to put anything over those open areas.
Okay, that's a really great question, Yvette.
Yeah.
So I guess the last question, this was one that I had. Yeah. I'm wondering, now I know you're involved in the clinic here. Do you have any clinical trials underway here at UT Southwestern that people could participate in?
So we do have a lot of people in our department that are doing various forms of research. So I would recommend that you go onto the dermatology website and kind of click where you can see who is doing active research and kind of the various aspects of dermatology that people are looking at here in the department.
Okay, yeah. That sounds great. Well, I think we are running close to the end of our chat. So I want to thank everybody for the wonderful questions. You've been a wonderful audience today. And again, thank you for joining us, Cynthia. And next week we have 2 chats next week. We're going to be talking about skin cancer with Dr. Nijawan. And then we're also going to be talking about endoscopic ear surgery at the end of the week. So stay tuned for those. But in the meantime, thank you very much.
Thanks for having me.